right, I'm giving folks a couple minutes. I think we can get started. So happy Thursday. Thank you everyone for jumping in. I think we have a really exciting session for you today. So we're going to be talking about how we can navigate healthcare marketing using Oracle Eloqua. And we have Newport Healthcare here that's going to talk a little bit about their marketing challenges and how they overcome some of them using Eloqua. So to get us started, let's change my slide. Quick introductions. My name is Melissa Santos. I am the Director of Consulting Services here at Relationship One. I am joined by one of my colleagues, Scott Ingram. He is one of our account directors. And we're very lucky we have Victoria Khan here as well. She is the AVP of Marketing at Newport Healthcare. A little bit of a lay of the land and how today will roll out. So I'm going to spend about 12-15 minutes talking about some of the common use cases we hear in healthcare marketing. Then I'm going to roll a little bit into the Oracle Marketing Cloud, talk a little bit about that, and specifically Eloqua, some of the capabilities that Eloqua provides to us that helps us address some of the challenges that we'll talk about in healthcare. Just a quick housekeeping note as we're speaking, if anyone has questions that they'd like answered after the presentation, just shoot them over in chat. I'll keep an eye out for those, and then at the end, we'll address them. After I speak for that 15 minutes, we get the pleasure of hearing from Scott and Victoria. So Scott and Victoria will have a little fireside chat so we can hear more about Victoria and her team and what Newport Healthcare is doing in the marketing space. So with that, I'm going to jump into some of the use cases that we more commonly hear. And usually it's two target audiences. There's patients and there's healthcare providers. And there are certainly some commonalities that we see, right, in those use cases and how we need to talk to folks. A lot of it's around ongoing communication and deepening those relationships, encouraging certain actions. In the patient marketing space, a lot of it is around encouraging patients to take some sort of action, right? We might want to have them do health screenings, maybe take advantage of telemedicine. Perhaps we want to do some community outreach or gather feedback. But again, a lot of it is around this ongoing communication, deepening those relationships, and really targeting the right people so we can speak to them at the right time. Healthcare provider marketing, some of those commonalities still are at play, right? We still want to deepen those relationships. We still want to have those ongoing communications. We still want to have relevant content. But our strategies might be a little bit different, right? So we might want to do some event marketing. Maybe we're doing some brand awareness. Maybe we are providing thought leadership or doing some referral marketing. So there's various ways, right, that we would want to reach out to our healthcare providers versus our patients. But again, some of those common pieces still prevail. We still need to make sure we're targeting appropriately. We have personalized content. And our messages are resonating, right? We're truly looking to deepen some of those relationships. And how do we do that? Well, Eloqua plays a big role. Eloqua is one piece of a larger puzzle. So this is kind of a 15,000-foot view of the Oracle Marketing Cloud. That's Oracle's cross-channel marketing platform. And there's multiple pieces of the puzzle. Like I said, Eloqua is one of them. Eloqua is Oracle's marketing automation tool. Responsis is Oracle's campaign management tool. It's more on that B2C, it's more of an ESP type platform. There's also Unity, which is Oracle's customer data platform. And as part of that, we have Unity Behavioral Intelligence, which lets us do more real-time communication, real-time personalization. And last but not least, there's CrowdTwist, which is Oracle's loyalty and rewards platform. Going a little higher, so now we're 30,000-foot view. The Oracle Marketing Cloud is one piece of the greater CX Cloud platform. So we show this slide just to give you a sense of where marketing falls in that greater ecosystem. And marketing is just one of many CX Fusion applications, right? There's sales, there's commerce, there's service. You can see here. So again, just giving you that wider view of the entire cloud platform. So now we'll dive a little bit deeper into Eloqua specifically and some of the capabilities that Eloqua provides us as healthcare marketers. And at the center of all of those capabilities, right, is the ability to be HIPAA compliant. That is extremely important in our space. And Eloqua gives us that ability. It gives us the ability to have a HIPAA compliant what we call actionable profiles. So we can utilize the information on that record while it's still secure. And you can see some of the standard capabilities that Eloqua comes with, right? So obviously campaign orchestration and being able to target our clients very specifically, target our patients, being able to build out workflows, whether that's for campaigns or lead management, managing our assets, measuring what's working, what's not working. You can't go nowadays without talking about advanced intelligence, right? Everyone wants to know what we can do with AI, machine learning, how does that all play in? And I'll talk to each of these a little bit deeper as we get into the presentation. Before I do that, this is just a quick snapshot of some healthcare and insurance organizations that are using Eloqua today. You can see Newport Healthcare is one of them. Okay, so now I'll spend a little bit of time diving a little deeper into some of these core capabilities. Campaign orchestration is kind of the meat and potatoes, right, of what Eloqua allows us to do. And again, it starts with that segment. It starts with our core target audience. And then we're able to build workflows, if you will, around the communications that we want to send. So we're able to create these multi-channel programs, these multi-channel workflows, so that we can send emails, we can send text messages, we can drive folks to landing pages, for example. And we're able to do that based on perhaps their profile data or their engagement criteria or other actions they're taking, right? And again, going back to the importance of HIPAA compliance, all of this is secure, right? So we make sure with the HIPAA compliant feature that these emails are secure. And if we're pushing folks to landing pages, driving them to that content, that is also secure. So these are on authenticated portals. So there's a security feature so that we're not, sharing personal information. Segmentation comes first, of course, right? We need to be able to talk to the right people. And what you're seeing here is Eloqua's segment builder. So we're able to go in and very granularly pull out who we need to speak to. And we can use profile data, we can use engagement data, we can even use external activity information that we're pulling into Eloqua. And we create these audiences that get updated in real time. So, as more folks are added or meet that criteria, they can be pulled into our campaigns. It's the basis for trigger-based marketing. It's all of those things. Lead management and campaign orchestration is somewhat hand in hand, right? We're building campaigns to address various stages of the lead cycle. What you see here is Eloqua's lead scoring module, which is unique in the sense that we are able to score based on multiple criteria. So we can base our score on not just profile information and kind of contact data, if you will, but we can also score based off engagement. So we can see, are they the right person? Are they engaged? And based off of that, we can then route them accordingly. Maybe they go to sales, maybe they go to a different nurture pathway. Either way, the whole intent is to increase some of that speed to lead time. Our campaigns are nothing without assets, right? We need emails, we need landing pages, we need all of that content. Eloqua makes it very easy to do that because marketers can go in and quickly do drag and drop assets, right? We can create these on our own without necessarily needing HTML knowledge or CSS knowledge. What's super important, especially in this day and age and in our industry, is personalization. And Eloqua makes that very simple. We can create dynamic content blocks, which basically means what I see on this email could be different than what Scott sees or Victoria sees, because it's basing it on, again, maybe contact information or engagement behaviors, whatever it might be. And we can then reuse those content blocks in other assets. Measurement analytics, that's at the core of what marketers do, right? We need to know what's working, what's not working. Let's do more of this, maybe less of this, modify that. And Eloqua comes with 13 out-of-the-box dashboards, over 200 reports that we can slice and dice however we need to. We can even track attribution across campaigns. So again, we can see what's having real impact to the business. The HIPAA feature is important here as well, right? Because we want to make sure that we're limiting who has access to some of this data. And our HIPAA feature does do that and make sure that we're limiting who can access any kind of personal information. Sales tools kind of go back to the sales marketing alignments that we saw on that earlier slide. What you see here on screen is one of Eloqua's sales tools. It's Eloqua Profiler. Profiler lets sales or really anyone hop in and see a contact's activities. So you can see here, right, you can see the contact's latest activities. You can see the various engagement metrics they might have with email opens, website visits, things of that nature. And at the top left, you can see the little red box. You can see their lead score. So again, sales can know, what are these individuals doing? Are they hot? Are they cold? All of those things are right here. Eloqua's Engage tool is different. That allows sales folks to send pre-approved emails to their contacts. And usually they're email templates that sales can personalize in different ways and then send them out to their contacts, and then have the ability to see how those contacts are engaging with the content. Advanced intelligence, that's again the big buzzword, right? Artificial intelligence, what can we do? With the advanced intelligence package in Eloqua, we have a number of features that help with some of that. So we have something called send time optimization. With send time optimization, we're able to send emails based on when the recipient is most likely to open. So maybe I open best at Tuesday at 3 and Scott opens best on Thursday at 2, right? So it will send based on when they're predicted to open it. There's also subject line recommendations built in, which subject line might work better than others. We can run fatigue analysis reports to see, are we saturating these contacts too much with content? Are we maybe not sending them enough? And then what you see here is what's called an account engagement score. And so earlier, you saw the contact score. This creates an engagement score for the account. So we can base that off of the engagement of contacts within that account. Now, as we've seen, there's a lot of capability within Eloqua itself, a lot of out-of-the-box integrations that we can utilize. We can also go to the Oracle Cloud Marketplace and look at lots of other applications that extend those integrations. There's over 500 pre-built apps and integrations that we can use to connect Eloqua with third-party systems. Maybe they are features that enhance the capabilities of campaigns or automations, cleansing, things of that nature. And last but not least, again, just wanted to talk a little more about the HIPAA compliance actionable profiler. You can see an example here, right? The actionable profile in Eloqua allows us to do some of that segmentation and personalization we talked about earlier, because we have access to all of the things, right? We have access to all the contact information, preferences, activities, engagement. In our space, we need to make sure that information is also secure. And that's part of the HIPAA feature. We make sure that this information is restricted. It's only accessed by those who should access it. It's very, it's locked down as much as it can be, again, to create that level of security. So with that, we're going to jump to the next phase of the presentation, where we get to hear from Victoria and Scott to hear about what Newport Healthcare is doing in marketing. And just a little background on Newport Healthcare. If you're not familiar, they are one of the nation's leading providers of behavioral health care for children and teens and young adults. They have locations in 12 different states, including 73 residential treatment centers, 22 outpatient programs, and 1 inpatient psychiatric hospital. And so with that, I will hand things off to Scott and Victoria to hear a little bit more about their marketing efforts.
Thanks, Melissa. Victoria, super excited that you joined us today. As a quick reminder for everybody on the webinar, feel free to use the chat or the Q&A at any point if you have questions. Melissa will help monitor that, and we can surface those as we get towards the end of our conversation. So feel free to throw those in as you have that idea. Victoria, I would love to hear just a little bit more context about you and your role within Newport Healthcare as an AVP of Marketing.
Yeah, thanks, Scott, and thanks for having me today. I'm excited to be here. So my name's Victoria Kahn. I'm the AVP of Marketing at Newport Healthcare. Really just responsible for overseeing the development and execution of the marketing strategies for our family of brands at Newport Healthcare, and also for overseeing the management of our vendor relationships like those of Oracle and R1. We have a robust in-house marketing team. We're doing our own content, graphic design, digital, social, paid media, events and continuing education. And we also have a dedicated B2B team that's doing sales enablement for our clinical outreach team. So similar to what Melissa shared at the beginning of the presentation, we really have two target audiences. So we're looking at both that D2C, so that's our parents, loved ones, potential clients themselves, our patients, and then B2B, so that's referring professionals who may be referring a patient that's under their care to Newport for a higher level of care or a step down, depending on where that patient is in their journey. But all of our teams are leveraging marketing automation tools or this marketing automation tool and the development of that customer journey for those two audiences.
Excellent, excellent. So what prompted you to start this journey in the first place? What were you originally trying to solve for as you looked to marketing automation as a solution?
Yeah, sure. So when I joined Newport a couple of years ago, we had a marketing automation tool in place and it was fine. It was meeting our basic needs for email marketing, setting up some, pretty basic landing pages, that type of thing. But as the security climate has really continued to evolve over the last couple of years, we found that it was important to have a partner who was going to give us confidence in HIPAA compliance. So first and foremost, we wanted to find a marketing automation tool that was going to give us that HIPAA compliance feature. That was first. Then we also wanted to have a tool that was going to be easy to use. So allow our team to be nimble and developing landing pages and setting up custom templates for emails and doing all this without the intervention of an outside dev partner. We don't have an in-house development team, so we want to be able to do that with drag and drop and make it as simple as possible. We also wanted to continue to grow in the sophistication of our lead scoring programs. So we already have a lead status program set up, but how can we move those leads through the funnel more quickly? How can we better warm them so that we're really as effective as possible when we're handing that lead over to our clinical outreach team for direct contact? Another component was looking for a tool that could support multiple brands within one centralized tool. So we have a whole family of brands and we want every one of those brands operating out of the same tool. But overall, just having that simple, intuitive, easy to use interface, that was a big selling point.
Yeah, excellent. HIPAA is such a huge consideration for anybody in the healthcare space. Melissa mentioned it multiple times. You talked about it being really a key criteria for the platform that you chose. How are you thinking about that? What are some of the considerations and just how are you balancing that need to communicate with your patients, but also with the privacy requirements and regulations?
Yeah, so at Newport, as a healthcare provider, protecting our clients and our prospective clients and even our reference data is of the utmost importance. So we just really needed to find that tool that was going to give us the confidence that the incoming data was going to be secure and that our marketing was going to be in compliance. So, whether you're looking for a tool that is going to enable you to have a secure patient portal, or you're really just trying to make sure that the data is clean coming through your web forms, it's really important that you work very closely with your legal team, your IT team, your compliance teams to ensure that you're meeting the compliance requirements that are going to be bearing for your business's unique business case.
Yeah, absolutely. Such a big consideration. Obviously, having somebody that obviously a platform that supports it and is a defined element, as well as a partner that understands the space as you have those conversations internally within your organization. Let's talk a little bit more about the partners, right? You've talked about your partnership with Oracle, but obviously there's work we've done together in sort of implementing this. How do you think about that partner landscape and the criticality of that?
Yeah, great question, Scott. So we started our implementation in July. We've worked with a couple of partners, including R1. And, my biggest learning moment and biggest advice that I can give is that, before you begin your implementation process, it's so important that you really outline the needs of your business. What are your priorities and what is it exactly that you are looking to achieve with the marketing automation tool? And then clearly articulate exactly what those needs are back to that partner that you're considering. And, one thing also to consider is that every CRM is set up a little bit differently. Everybody's Salesforce is set up to meet their unique business needs. So it's important that your implementation partner understands that structure and that you are going to, from the marketing perspective, get that data flow back to your marketing automation tool so that you're communicating with the right contacts and not communicating with the contacts that you don't want to communicate with. So, also beyond that, it's just so important that you allow enough time and enough hours within your partnership to account for IP warming in the email marketing process, program setups, testing, more testing, making sure your web forms are working correctly, your data is syncing to Salesforce or your CRM correctly, and just ultimately going back and making sure that that implementation is done to best practice.
Yeah, absolutely. Absolutely. And I love that you kind of started with being really clear about this is what we're trying to do, right? Let's make sure that we have clearly defined sort of objectives. What are those for you? Like when you think about what you're looking to achieve and just how you're measuring success with this program, what are some of those things?
Yeah, so we're really early in our journey still. First priority for us was just getting email marketing programs built, set up, warmed, and running. So from there, we went into building out landing pages, getting basic nurture programs stood up. But that first step was just the basics, just email. Ultimately, what we want to achieve is creating an experience that's really customized to the specific prospect. So, what type of services are they interested in? What kinds of content will provide the most value to them? What are they a parent or a family member? Are they a referring healthcare professional, or are they a prospective client? All of those types of identifiers are really important in creating that customer journey, and we'll measure that success through increasing that speed to lead, as Melissa said, improving our conversion optimization on our landing pages, and improving click-through rate and email programs. That's just really scratching the surface.
Yeah, absolutely, absolutely. You have a lot of dynamics going on as well. We've talked about the different audiences that you're communicating with between patients and healthcare providers, but you also mentioned you're juggling multiple brands. So how are you solving for that unique set of challenges?
Yeah, so Newport Healthcare is the umbrella company of a family of brands. So we have Newport Academy, which is our residential and outpatient level of care for children and teens. Newport Institute, similarly, but for young adults. Prairie Care, which is a health system in Minnesota that provides a full continuum of care, ranging from an inpatient psychiatric hospital for youth all the way through residential, outpatient, and clinic for all ages. And then finally, Center for Families, which is an outpatient specific program. And it was so important that we have a tool that would enable us to eliminate ancillary marketing automation tools, get everyone operating on that same marketing automation platform so that we're creating that consistent user experience that's tested and proven across all of our brands.
Excellent, excellent. I've got a question from the chat that I'll go to first before I ask a couple of follow-ups. And that is, and with this, Victoria, you can answer these. We can also lean on Melissa a little bit if needed as well. But the question is, how does Newport Healthcare or other healthcare marketers, my questions are jumping around, balance personalization with compliance requirements in automated campaigns?
That's a great question. I think that Melissa probably will be able to answer that one the best, as we're still pretty early in our journey. We haven't gotten that sophisticated yet. Certainly somewhere we'd like to go, but I'd love to understand more about the capabilities there too.
Yeah, happy to jump in. I mean, from what I think from what we have worked on with our clients, it is a balancing act, and you want to make sure that you're respecting their preferences. So often we'll want to make sure that we're doing really in-depth preference management, right? That's something that's really important to understand. What do they want to hear about from us, so that we're targeting them appropriately. With that said, a lot of the security features focus on that personal information. So there are ways, right, that we can still continue to communicate with these individuals without utilizing some of the personal information, because we still often collect preferences, like I said, or we know about their digital behavior or their activities, or maybe other information that we can collect that would not necessarily be, personal information. So it's definitely a balancing act, and quite frankly too, it does vary by how comfortable the client is, how comfortable their legal team is, and those kinds of things. So there's a lot of checks and balances we have to do.
Yeah, great feedback. Victoria, from a been there, done that, or been there doing that perspective, what advice would you give to other healthcare marketers that are looking to implement a marketing automation platform like Eloqua?
I definitely would check with my legal team first and foremost. What are we trying to solve for? What do we need to be mindful of from a marketing perspective, especially as we start working through this more complex HIPAA environment? Does this tool that we're considering, does it scale for us? Is it going to meet all of our compliance needs? If we need an additional layer of compliance, do we need an additional CDP or something like that? Can they somehow work together? How does this data match up? And ultimately, is the tool really going to work for my team? Is it going to be usable? Do we need development resources in-house to be able to really help bring these programs to life? Or do I need a tool that's going to be a little bit easier to use based on the skill set of the team that I have?
And another great question that kind of follows that, from that team perspective. So any suggestions on how to support teams with changing to a new marketing automation platform, and just being mindful of training and processes, and just maybe the enablement that you're doing with your team as you're making that transition?
Yeah, great question. So it's been so important for us to document. I'm a person who likes to go back and reference a how-to sheet. This is my process document. This is how we do things correctly. So as you're learning to use the new tool, take screenshots, document the process, have somebody from your team be that lead, be the marketing automation tool owner, so that they're kind of the expert, in-house expert that other people on the team can go to as a reference. And also, working with a strong implementation partner, they are going to teach you along the way too, and they're going to understand what it is that you're trying to solve for and what's priority on your roadmap. It's really important that we get this email template built right now. That's the thing that we've got to have before we hit the ground running. So making sure that the team knows how to pull in the different lists, how to segment, how to suppress, how to move things around within the templates, whatever it may be, whatever that priority item is for you, lean on the support that you have and document those processes.
Yeah, the documentation is really key. And, a lot of what we're working with our clients on and doing that is being mindful of the overall governance, right? What is our process through that? Are we using similar naming conventions so that things are reusable and consistent in the way that we do it? And particularly in highly regulated environments like healthcare, that we have good checks and balances and QA processes, so that all of the risk isn't on me, because I've done this 5 times. I thought I know what I was doing. I wasn't following the checklist, and I missed a super important step, or I didn't double check my segment, and I just sent this to our entire database, or some crazy thing. Again, just having that second set of eyes to make sure things are really, really clean. Victoria, this has been so great. I always like to look forward, right? What's next? Where are you guys going from here?
So I think from here, we're just going to continue to iterate on the programs that we put in place, continue to test, continue to refine what's working, what's not working. You know, as you look at these multi-component campaigns or nurture programs, if you will, where are people engaging with the content? Where are people clicking through? Where are they not? And just continuing to like let that be a living, breathing process. So iterate on your programs that you have in place, iterate on your lead scoring model. You know, I'd love to look at how you can go to that account level scoring that Melissa was describing. That's a great goal. Um, and then just continuing to keep creating more content, create more robust nurture programs. So, you know, are we going to create programs that are specific to the admissions process, specific to the needs that a referring professional may have when they're working with a clinical outreach specialist? Are you interested in a type of service that we offer, whether that's residential, outpatient, et cetera, or, you know, even disorder specific content so that you can, again, circling back to what we talked about at the beginning, creating that user journey that's really specific to what your needs are and what you're interested in. And then just continuing to look at where we can integrate more programs that we're using into the marketing automation tool so that everything is as connected and automated as possible. A big component of our business is doing CE, complimentary CE webinars for our referring professionals. And, you know, having that integration set up with our CE platform makes the job of the marketer so much easier if you're not having to download a list, upload a list, sync it to your CRM and so forth, and just allowing for the tool to be integrated and automated.
Love it. Love it. I love that word iterate, right? Like what can we
Yeah.
learn? How can we improve? Repeat, 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 keep iterating, keep going one step at a time, right? Excellent.
Exactly.
Victoria, again, so great to have you with us and to talk through this a little bit. And I'll hand things back to Melissa to take us home.
For sure. Well, thank you. That was incredible. Um, Scott, you asked a lot of the questions that came through chat. You guys did it in real time. There was one more, and by the way, if anyone else has additional questions, please, now's the time, throw them in the chat, throw them in the Q&A session. But one question did come up that I'll throw out to you, Victoria. How do you define a center of excellence, and what exposure have you had with your partners to define and seek more value to be a COE?
With Center of Excellence at
Yes.
Oracle? I will tell you, the experience that I've had with the Center of Excellence at Oracle has been second to none. I have been so impressed. There's real experts that are a resource for you that can really just help you. They're not going to do the work for you. Like, let's be clear. It's about understanding that your implementation is up to best practice and auditing the way that you're using the tool and giving you the resources to set that tool up to support you the best way possible. I hope that answered the question.
For sure, for sure. And you know, sometimes too, you know, what we see on our side is setting up that internal center of excellence as well. It kind of goes back to some of the previous questions of how do you support a marketing automation tool with the platform itself, with training and process, et cetera. So you covered some of that, but any additional thoughts on internal COE?
Yeah, I think that to circle back to maybe what I said before of like having that in-house expert and empowering a member of your team to really take the lead, be the expert, understand the tool better than anyone else, own the documentation of the processes, be the resource in-house. And then, you know, if you go beyond what the scope of that individual's skill set is, you can always look to Oracle or an implementation partner to help you figure out the solution that you're looking for, whatever that challenge may be that you're trying to overcome.
Excellent. Well, I don't see any more questions from folks. We'll give it one more second here if more come in, but thank you. Thank you, Victoria, for joining us. Thank you, Scott. This was amazing. Just a quick, as part of a wrap up, just a reminder, let you guys know, in the next few days, you should receive an email from Eloqua, of course, with a link to the presentation and some additional resources.
Well,
Other than that,
you have
yeah.
one more question,
Oh,
Victoria.
one more came in.
From the perspective of the larger ecosystem, how do you bring your peers alongside you on this journey, right? Oftentimes this is marketing led, but we've got to work with IT, we've got to work with sales leadership. Again, you talked about legal. How are you doing that and just thinking about that process and bringing everybody along?
I love this question. I think that's a great question. So I always like to think about IT as being like my hand-in-hand partner. Like marketing will not succeed without that strong foundation with the IT department at your back. Like that's so important. So throughout the search for a marketing automation tool, IT was there with us lockstep. We want their opinion. We want them weighing in on making a decision that's going to integrate with our CRM, making sure that we're choosing a solution that is going to meet our needs from a compliance perspective. IT really adds that layer of knowledge that you may not see as a marketer. So I'd love to have that partnership with IT and think about them as, again, hand in hand through the marketing automation tool selection process and through the implementation process too. There's so many intricacies as you are going through an implementation that are going to involve you syncing fields from the marketing automation tool to the CRM, and you're going to have your CRM expert there with you along your side. They're going to be working to make those implementations and testing and making sure that it's done correctly. So I can't say enough how important it is to have a strong partnership with IT from the beginning and through the implementation. And then of course, legal as well. That's so hugely important to make sure that you're meeting the compliance needs and really at the end of the day, protecting the client, protecting the customer's data. It should be of the utmost importance.
All right, excellent. We did get one more question I can throw in. It says, does the platform ingest billing and revenue data from the health system? And is it able to provide an attribute ROI to individual tactics campaigns? I don't know, Victoria, if you want to speak to that at all as far as what you guys are doing, or
I'm going to punt that one to you, Melissa.
Punt that one to me. Okay. So yes, the system can certainly ingest billing and revenue data from various systems. There's multiple ways we can do that. How we do that really depends on requirements. It's not always a typical process. As far as revenue attribution, again, that's kind of a deeper conversation around your systems and business intelligence tools and what would make the most sense to how we want to calculate attribution across those campaigns. I don't know, Scott, if you have anything to add to that, but from my lens, that's what I'm thinking.
Yeah, for sure. And it depends question that it depends on what those systems are, whether we're flowing it directly to Eloqua, or oftentimes that might be coming through CRM, might be coming through a Salesforce, and then running attribution from there. So definitely possible, but more than one way that we can tackle that.
Excellent. One more question popped in. They're coming in. So the question is, and Victoria, I think this is more for you. Are you doing white space marketing? If so, what sources of data do you use?
I don't really have a great answer for that one, and I don't want to. But
and they did come back and say white space equals non-patient targets.
So okay, non-patient, yes, absolutely. So thanks for the clarification. I appreciate that. So a huge part of our marketing role is bringing in our B2B audience. So that's the referring professionals. So we have an entire team within marketing dedicated to just B2B support, to that sales enablement piece. So that's helping our clinical outreach team market themselves in their territories through email, social media, setting up CE webinars within their respective areas to try to bring in people that are like-minded, of interest, that are in the mental health care space, and just give them value, give them complimentary CEs, that type of thing. Provide that thought leadership. So that's a huge part of our marketing component, is focusing on that B2B, that referring professional audience, beyond just the patient or the parent.
Awesome. I don't see any additional questions coming in. They said thank you.
Thanks.
So again, thank you, Victoria, thank you, Scott. Thank you for all the wonderful questions, those of you that sent them in. And again, just a quick reminder that you should be getting that email in the next few days that does link out to the presentation, as well as a few other resources. So I appreciate it. Thank you all.
Thanks for having me.
Take care. Have a great day.